Well, I'm going to go ahead and get started. Good morning. My name is Sunita Patterson. I'm a senior scientific editor on the scientific publications team in the Research Medical Library. Today I'm going to be talking about the specific aims, which are the steps or parts of a research project that are outlined in many grant applications. We decided to do this webinar because grant reviewers have told us that projects with logical and clear specific aims are a pleasure to review, but poorly designed specific aims can sink an application. So I'm going to share suggestions for crafting the specific aims with the goal that reviewers will easily understand the components of the proposed project and will feel confident that the project will lead to valuable results. So for the next 35 minutes, I'm going to be talking about how to design or structure the aims and how to write the statements of the aims. This advice is drawn from my group's experience in editing grant proposals and from the resources that I've listed in the handout, and you can download the handout at the bottom of the screen. Please feel free to ask questions in the chat room, and I'll try to answer them periodically or at the end of the webinar. And we'll be posting a link of this recording on the Scientific Publications intranet site so that you can refer back to it next time you're writing a grant application. So now I'm going to turn off the camera and start the slides. Okay. So note that I'm not talking about the whole specific aims section today that's part of an NIH or National Institutes of Health proposal, but rather the actual aims themselves. And so a note about terminology. I'll generally be using the term specific aims or simply aims to refer to the studies or steps, the work to be done. But the term specific aim is also commonly used to refer to the statement describing the work to be done, basically the title of that portion of the project. So I may use the term both ways, but it should be clear from the context what I mean. Today I want to provide guidance for achieving this goal articulated by the NIH. Make your aims sing and harmonize. Craft your aims carefully so reviewers will see both their individual and synergistic worth. You want the grant reviewers to see that together the specific aims will lead to a significant scientific advance and that each aim individually has an important role in that work. So this has to do with how the aims are designed and how they are described. First, I'm going to discuss 6 guidelines for designing the scope of the aims and what you plan to do for each one. Then I'll share 5 tips for writing the statements of the aims. We'll be looking at lots of examples, most of which are from abstracts for funded R01 projects in the public NIH Reporter database. Okay, so let's go on to talking about considerations for designing strong specific aims. So let's say you have an idea for a research project. Preliminary data have led to a hypothesis you want to test. Or instead of a hypothesis to test, you've identified a critical need and an objective that will fill that need. For example, you realize that an important problem could be solved using a device that doesn't exist yet, and your objective is to build that device. So you'll test this central hypothesis or accomplish the central objective through your specific aims. The aims provide the framework or organization of the project. In the grants we edit, we usually see 3 aims, sometimes 2 aims. And sometimes each specific aim is itself divided into sub-aims or studies. So our first guideline for designing the aims is that they should collectively test the central hypothesis or accomplish the overarching objective. So for a hypothesis-driven project, make sure that once you've completed all the aims, the hypothesis will have been fully supported or rejected. For a need-based project, make sure that once you've completed all the aims, the objective will have been achieved. So let's look at a few examples. So this hypothesis is from a project related to prediction of tuberculosis, or TB, in asymptomatic people living with HIV. The hypothesis is host protein and antibody profiles can constitute a biomarker for increasing Mycobacterium tuberculosis infection activity and predict the risk for development of TB. So let's look at aim 1 from this project. So I've used purple to highlight words in aim 1 that link back to the hypothesis. Aim 1 focuses on host protein biomarkers for increasing infection activity. Aim 2 relates to another aspect of the hypothesis, antibody profiles. I've used green to show its relation to the hypothesis. Aim 3 pulls the protein and antibody biomarkers together into a prediction model for risk of TB. So each of these aims has a clear role in addressing the central hypothesis. So let's look at a need-based project. This example is from a project. It's identified a need to develop a drug delivery nanowafer that can heal injuries to the cornea, including corneal neovascularization. So let's look at the specific aims, which are 3 major steps that need to be accomplished. Once these aims are accomplished, the nanowafer will be close to clinical translation. So for a need-driven project, the aims are often straightforward steps or tasks, as you see here, which is different from hypothesis-driven projects in which the aim statements are ideally more focused on the expected findings, what will be found rather than what will be done. And I'll expand on this later when I'm talking about writing the aim statements. So this is one more example from a hypothesis-driven project that shows an issue that I've seen when editing grant proposals. So the hypothesis is protein Z regulates oxidative stress via its coordinated functions in nuclei and mitochondria. So aim 1 talks about how protein Z functions in the nucleus for protection from oxidative stress. And you can see from the purple words how this aim relates to the hypothesis. Aim 2 talks about protein Z's functions in the mitochondria. Aim 3 talks about protein Z's regulation of oxidative stress. However, this aim also brings in a new angle, suppression of prostate cancer. So this angle is outside the scope suggested by the hypothesis. So in this version, and this is the way the PI wrote it, I altered it for the previous slides, the hypothesis has a second part, that these functions are necessary to suppress prostate cancer initiation. So the role of aim 3 is now clear. The project framework is thus more cohesive. So if you have an aim that isn't encompassed by the scope of the central hypothesis or objective, then look at either broadening the hypothesis or objective or dropping that aim. So let's move on to our second guideline for designing strong specific aims. Think about the aims as units of work that will have a clear outcome or endpoint or produce a research output. The NIAID, National Institute of Allergy and Infectious Diseases, has a great website with a lot of good information on grant writing. And they say, your goal is to create aims that have clear endpoints your reviewers can readily assess. So for example, when the aim is completed, you might have defined a set of biomarkers, developed a new model, validated a new instrument, tested a new treatment. So often each aim could provide the basis for a future manuscript. So for example, here we have the hypothesis that MIC and AP1 are key instigators of fibroproliferative remodeling in bladder smooth muscle. So here are the two specific aims from the project. So aim 1 focuses on MIC and determining its functional significance. Aim 2 focuses on AP1 and determining its role in remodeling and fibrosis. So each aim tackles a piece of testing the hypothesis and answers a distinct research question. Next, here's a tip from the Grant Application Writers Workbook by John Robertson et al. Of grant writers' seminars and workshops. And again, these resources are listed on the handout, which you can download at the bottom of the screen. Each aim should yield important or useful information, even if its outcome isn't what you expect. For example, you may think that the phenomenon you're interested in is caused by molecule X, but if you find that molecule X isn't important after all, you want your project to still be a success. So let's look at an example. This aim is somewhat weak because it implies a yes-no answer. What if molecule X is found to not initiate pathway G? It sounds like the project will have hit a dead end. That wouldn't be a very exciting outcome for this aim. So better to design the aim so that the product is the identification of the mechanism responsible for pathway G initiation, whether that mechanism ends up involving molecule X or some other molecule. So I'll say more later about the wording of this type of aim statement, but for now my message is to plan each aim so that it has a useful outcome, no matter what, not a single outcome that's necessary for the project to be considered a success. Three more quick guidelines to think about when you're planning the framework for your research project. Grant writing expert John Robertson recommends constructing the aims so that they're roughly equal in scope or weight. For example, it would seem out of balance if aim 1 is very complex and will take 3 years to perform, and aim 2 is very simple and can be accomplished in 2 months. So regarding the number of aims, look at dividing your project into 2 or 3 aims. That's what we normally see in R01 proposals. With 4 or more aims, there's a risk of seeming overambitious. Ideally, the aims will be independent from each other. This means that you should be able to complete each of your aims without having to complete the others. Avoid the situation where doing aims 2 and 3 only makes sense if aim 1 has the expected outcome. Design the aims so that each aim can still proceed even if the result of another aim is not as expected. For example, let's say aim 1 involves constructing a particular transgenic mouse, and it's tricky, so it might not succeed. So if aims 2 and 3 can't be done without that mouse, then the project will be considered to have a fatal flaw. Finally, make sure each aim is feasible. You want to instill confidence that you'll be able to successfully complete what you're proposing to do. So in your hands, the aims should be achievable in the time period specified by the grant, achievable with the resources and the amount of funding available. So for example, can your budget provide enough laboratory staff time to perform the experiments? Will there be enough money to buy all the mice you need? Will there be enough money for the equipment you need? And make sure that the aims are achievable by the PI and collaborators. Think about whether you need another collaborator with expertise in a key area. So, of course, you'll want to demonstrate that feasibility by providing supportive details in the relevant portions of the grant proposal. So those are the 6 guidelines on designing the scope of the aims. Are there any questions before I'm going to next talk about how to write the aim statements? So if you have any questions, feel free to type them in the chat box. And keep in mind that as you're thinking about the structure of your project, collaborators and colleagues can provide helpful feedback on the focus and scope of your specific aims. Also, program officials at the NIH are usually happy to review specific aims. Presented in a draft of a specific aim section of a grant proposal, that one-page section. Okay. Okay. Well, I'm going to go on and talk about writing the aim statement. So once you've decided on the scope of each aim, you want to describe the aims so that they're clear and compelling to the reviewers. So I have 5 guidelines to help you finesse your wording of the aim statements. This recommendation from the Grant Application Writer's Workbook builds on the idea that we discussed before, that each aim should be designed to produce useful data even if the outcome doesn't turn out as expected. Word the aim statement to convey that no matter how the experiments turn out, the aim will have been successfully accomplished and will have yielded valuable results. So let's return to the example that we looked at before. The wording of the weak version implies a yes or no answer, and the negative outcome isn't very exciting. So if you can, phrase the aim statement broadly, as in the better version here. It allows room for success even if molecule X isn't the key player. However, let's assume that the proposal is built around molecule X and you have strong preliminary data supporting its role in pathway G initiation. The broad aim statement can be paired with a working hypothesis that provides the focus for the aim and will be the basis of the planned experiments of that aim. So here's another example of stating the aim so as to convey the likelihood of success. In this weak version, the words investigate whether set up a yes-no question. There's an implication that perhaps the tumorigenic properties of potential cell types of origin are not defined by specific oncogene tumor suppressor alterations. That whether implies whether or not. So I think this wording would be better because identifying specific oncogene tumor suppressor alterations sounds like a more useful outcome. After this aim has been completed, rather than just knowing whether or not oncogene tumor suppressor alterations are involved, we'll know what they are. And there's room for multiple possible outcomes in terms of specific alterations, although a working hypothesis could focus on specific alterations that were suggested by previous knowledge or preliminary data. We talked earlier about designing aims to have clear outcomes or endpoints. To show that you've done this, when writing the aim statements, choose verbs that suggest completion. So these are strong verbs that all right, so let's go on to our next guideline. To ensure that reviewers understand the potential value of the work, use strong verbs that focus on the product or outcome rather than on the method. The emphasis should be on what will be learned rather than on what will be done. So for hypothesis-driven projects, you want to avoid process-oriented verbs like these when writing aim statements. Instead, use product and conclusion-oriented verbs, as we've been discussing. If your project is need-based and has a central objective rather than a central hypothesis, for example, if you're developing a new device or a drug delivery system, the specific aims are likely to be straightforward steps or tasks, and in that case, process-oriented verbs such as fabricate, optimize, test may be appropriate. But for hypothesis-driven projects, we want to avoid process-oriented verbs. So take a look at this adapted aim statement from a hypothesis-driven project. Notice that it starts with the approach, utilizing CRISPR-Cas9 generated mice bearing mutations in certain binding sites. The expected advance is stated to determine the importance and X isoform dependence of the anticonvulsant actions of agent Z, but that information is kind of buried. So I think it would be better to focus on the advance. Of course, the approach is important information to include in the grant proposal, but it can weaken the statement of the aim. So in this example, the wording is clear, but notice that, again, the initial focus is on the methods, behavioral pharmacology and in vivo voltammetry, what will be done. So let's revise this statement to focus on what will be learned. In this better version, the parts of the aim statement are swapped, and the statement now begins with the stronger verb, identify. The statement now emphasizes the most important and compelling information, the scientific advance, rather than the methods. And to be even more concise, you could delete the methods from the statement of the aim and just state the advance. Okay, last couple of guidelines for writing the aim statements. Make sure the statements use parallel grammatical structure. So in other words, the grammatical style for all of the aims should match. The aims should sound similar. So usually aim statements are presented as phrases that start with a verb, but different forms of the verb can be used. So for example, here you see aim statements that are not grammatically parallel. In aim 1, the infinitive form of the verb investigate is used. The infinitive includes the word to. But in aims 2 and 3, the root form of the verb determine is used. So either verb form is okay, but it's best to use the same style for all of the aims. So you could fix it. Here we've used the root form for all 3 aim statements, and now the aim statements are parallel grammatically. Or you could use the infinitive form for all 3 aim statements. So last but not least, make sure the aim statements are clear and concise. The Grant Application Writer's Workbook recommends writing the aim statements as brief, informative, attention-getting headlines. So let's look at some examples. These are simple and clear aim statements from 3 different proposals. So they're short and sweet. So this aim statement's a little long, but it's clear and easy to understand. And one more example. Clear and concise. So personally, when I'm editing a grant proposal, if I can look at just the hypothesis and specific aims and get a pretty good idea of the structure and outcomes of the project, then I'm really grateful to the investigator. I have a very clear idea of the project from the start. And I'm sure the grant reviewers feel the same way. So I hope these tips will be helpful to you in finessing the wording of your aim statements on future grants. Feel free to type any questions in the chat box. And while I'm waiting for questions, one last piece of advice is that once you've written the aim statements, be sure to use them consistently in the various parts of the grant proposal. So for example, use the same wording for aim 1 when you state it in the abstract or project summary, and when you write it in the specific aim section, and in the approach section of the research strategy. As a reminder, we're recording the webinar, and we'll post a link to the recording on the Scientific Publications intranet site. So in the future, you can review it and stop after each point as you work on your aims. These are the list of resources that I drew on for this webinar. They're listed on the handout, which you can download at the bottom of the screen, again, if you haven't already, and we will post the slides on our intranet site. I'll give you that address in just a minute. Here's the contact information for the Research Medical Library. And I just want to thank you all for joining me today. For MD Anderson researchers, I have a couple resources I want to share with you. First of all, our group of editors offers editing of specific aim sections and full grant proposals. And feel free to contact us with questions about grant writing, consultations. All of our services are free. Here's the link to previous webinars and recordings of presentations that our group has done. There's several related to grant writing, also manuscript writing. And I wanted to mention the Interest Program, which is a wonderful resource here at MD Anderson that's organized by Dr. Sanjay Shetty. You can submit your grant application, and then experienced grant reviewers on the MD Anderson faculty will review and discuss it. And they hold the discussion just like a funding agency study section, and you get to observe and see the reviewers discussing your proposal. So this is a great resource for feedback on both the design of your proposed project and the writing. And we've noticed that the reviewers' comments often address the specific aims. So thanks so much, everybody. Thanks for joining me. And I'm going to say goodbye.